Woo, that's right, y'all. It's your boy Charles Gregory, the beautiful
Lauren
and the
Sizzle.
beautiful.
Classy Lady
And you're
Sparkle.
listening to WPPMLP 106.5 FM. We talk weeklies after the talk, and we are streaming live, as you know, during this time of the COVID-19 pandemic. Everyone is doing, their
Social
lives, their
distancing.
such, practicing their social distancing and shooting from the comfort of their own homes. And I think we are getting the hang of this thing, and we're excited about some of the things that has been going on as it relates to us being more visible and reaching out to the good old folks. We got to get into Classy Lady
Okay.
Sparkle. Holla at your boy. Good news
All
and bad
right.
news.
Which you want, Sizzle? You want the good news or the bad news first?
Um, Give me the good news.
All right, cool. I'm glad you said that one. This one is kind of just news. I won't even call it good bad. It's just news. Bernie Sanders dropped out of the presidential campaign.
No, that's bad news.
I know, because I'm saddened behind it.
Yes,
He's
yes.
he's ended his journey to a potential commander-in-chief of the United States. And honestly, I was going to vote for him.
I
Um,
know I was.
Yep.
I,
It's obvious that Bernie made the decision that he felt was comfortable for him and his family. But I like to echo what a good brother, Van Jones, he's the political commentator with CNN. He had said this on the Breakfast Club with Charlemagne the God. He said most people thought that Bernie had old ideas of the 60s and 70s, which wouldn't fit into the new modern day times. But with the pandemic, Bernie doesn't sound so crazy. Bernie
there you
wanted
go.
universal health care for all people,
That's right.
pandemic. He wanted raising minimum wage for grocery store clerks, fast food restaurants, Walmart people,
That's right.
CNAs, pandemic. I'm saying pandemic after just to let you know how how appropriate this is applied. He wanted housing for all people, no homeless people. He wanted to spend close to $1 trillion just so everyone can have shelter.
That's
Guess
right.
what? Pandemic.
yes.
He also wanted paid family medical leave. Now we have FMLA, but it's not paid. He wanted paid family medical leave act to take care of your loved ones. What are people doing right now from work
Right.
based on the pandemic? So Van said
Right.
Bernie was not crazy and this realistic information came to be true.
That's right.
Oh, we're going to miss you, Bernie, because I
Um,
mean,
oh my gosh, it just got real dry.
yeah, so
And
on point.
it just got real dry.
Yeah.
Yeah. All right, so
I'm
here's
extremely disappointed. I'm a Bernie supporter, 100%, 100% Bernie supporter, and I was very, you know, um, saddened that he, left out of the race. And I think that
mhm.
most of us didn't do our job. We didn't do a good enough job in making sure he had the platform and that people knew what he stood for as it relates to what's going on right now. Because I'm
Yeah,
telling you, just like you said, just to echo your points as it relates to Bernie Sanders. Everything you said was accurate, and it would have been very consistent to how to, uh, you know, be vigilant in these times of the pandemic.
very,
Yeah.
very.
Hmm.
All right. Well, here's your bad news.
Right.
Black people are dying of COVID-19.
Hmm.
All right. So many have heard the myths and facts of the coronavirus. One fact is, why is this virus hitting the Black community so hard?
Hmm.
Although the virus doesn't discriminate and was derived from Wuhan, China, the virus is starting to take on another face.
Hmm.
While everyone is susceptible to COVID-19, Black Americans are at a higher risk. Surgeon General Dr. Jerome Adams said during an appearance on CBS this morning on Tuesday's show, health disparities have existed in the Black community almost forever. And now the White House is shining the light on this, but what seems to be, in my eyes, in a very destructive way. According to the state's public health data from April 9th, it shows in Chicago, out of 70% of COVID-19 cases, 30% were of African Americans.
Mm.
In Milwaukee, 66 of the reported COVID-19 cases, 66% that were reported, 26% were of African Americans.
Mm.
New York City, out of 28% of those cases that were reported, 22 of African Americans. And here in Philadelphia, out of 61% of reported COVID 19 cases, 42% are African American. So I believe some of this data, though, is skewed because all people of different races who were asymptomatic or symptomatic did not get tested. However, as a Black woman and as a journalist reporting on this issue, I hope that this changes America's eyes to what has been disparities in the healthcare system. This is 2020, and because of discrimination, poor health, and insufficient health insurance, Black people are still at a disadvantage.
Mhm.
Here's a few reasons why. There's a high percentage of Black people working jobs that were once considered non-essential, minimum wage jobs, but now, due to the pandemic, are considered essential and placing Black people in the front line. Public transportation, fast food, nursing homes, similar to what we talked about in the good news. The Black community also suffers from comorbidities, which are underlying health conditions like asthma, high blood pressure, kidney disease, cardiac disease, and cancer. With these vulnerable complications, the African American community are now receiving inadequate health care, which makes us more vulnerable. The data that I shared with you sadly proves that race still matters, and we as a Black community need to come together to educate others and place a call to action. For those millennials who say they never experienced racism, if you appear to look Black, wretchedly, you may now encounter it. In Guangzhou, China, many Africans who have not been exposed nor diagnosed with the coronavirus have now been evicted from their homes and placed on the street and turned away from hotels because of the color of their skin. This is due to the heightened media coverage of many African Americans disproportionately succumbing to the virus. Although some of our underlying health issues are genetic, we must practice healthy preventive measures to ensure that we are still here for our families.
Mm.
And that's your I was so biased in writing that art or that editorial, you guys, which I don't normally do, but I just feel like the media has given this virus a face now of what was derived in China and now giving it to us. And I just think that that information to me is skewed.
Yeah, and that's a nice way of them to try to flip the script.
Yeah.
Yeah.
Yeah, it's interesting that I mean you brought that up because you know what? I think we need to just how can we I think the question is how can we uh get the information out to our community in a language on a frequency that they can understand? How can we do that? That's the question.
Well, when I was getting dressed to come on here, I was listening to Tupac, and he was like,
All eyes on me.
no, the one he says we gotta change the way we eat.
Oh,
We
dang.
gotta change the way, yeah. And it's the truth. It's like through our music, it seems like that was the way a lot of that, like with NWA and Public Enemy, that was a lot of ways that they were giving us that conscious thought of F the police and things that we wouldn't do. It seems like we have to go through the culture in order for
Mhm.
it to be understood because the younger ones, the children are our future. And it's like it's a lot of the older people have the ideas and have the understanding. It's the ones that are coming up.
Yeah.
Yes.
Yeah. 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 I mean, yeah, you still have some older folks out there, however, that believe that's really heavy on this conspiracy theory and feeling that, no one they can't get it or is caused by something completely different. So what do you say about that?
You mean you think more of our older generation think that it's conspiracy theorists?
A lot of them
I
do,
heard
yeah.
that. I have
Really?
the tape.
Well, the reason I think that only reason I think that to a degree is because I've heard that there are still a lot of churches being held where they're saying that, oh, I'm covered in the blood. It can't affect me.
That's
I
right.
think that they have that mindset of conspiracy theory. I don't think that the baby boomers and above fall into the whole 5G conspiracy. I think it's more from a spiritual just that kind of mindset.
Mm,
But a lot of them are passing away. A lot of the baby boomers and the older generations are the ones that are succumbing to it, not just being tested positive, but are not making it out.
Right.
So unfortunately, if they have that mindset and know that these people our people are dying,
that's right.
hopefully they'll have a different outlook.
Yeah. Well, no doubt, no doubt. Well, is that the good news and bad news?
That was your good news and your bad news by Classy Lady Sparkle.
And that was your good news and bad news, ladies and gentlemen. It's your boy Charles Gregory with
Lauren Sizzle.
the beautiful.
Classy Lady Sparkle.
Yeah, and I just want to shout out Hazel, Gentina, Michelle, and Tina, who's watching this live feed right now. And
Hey,
we're
yeah.
about to bring someone with whom I have a tremendous amount of respect for. I've been looking at this young lady's bio, and very, very interesting and in depth, man. Maybe she can give us some jobs, man. Creator, she's just one that I was just like, wow, interesting. Something that I don't necessarily think about, but I'm not gonna let it out right now. I'm gonna let Sizzle do the honor. Sizzle, who do we have today?
Hey, what's up, you guys? It's your girl Lauren Sizzle and Classy Lady Sparkle. And have you subscribed to our channel yet? If the answer is no, you need to subscribe now. Yeah, so stop what you're doing, go right now and subscribe. We like you, you like us, so go ahead and subscribe. Come on over, be a part of the family of We Talk Weekly and subscribe to our YouTube channel. So what are you waiting for? Subscribe now.